Good morning. This is our last video, or the fourth and last part of the semester 2 revision for the final test. In the last video, at the end, we were talking about biofilms, and now we're going to talk about the risks of biofilms. Of course, the main risk, if I ever ask you about the dangers or the risks of biofilms, so the main risk of biofilms is that they might transfer infection to other people. So if you have a biofilm on a doorknob or on a countertop or on a desk or on a magazine, then this is a good source of infection, direct contact infection, to be transferred to other organisms. But today we're going to talk about a more serious effect of biofilms. And this, you can consider this the second serious effect of biofilms. And the third one would be, of course, that biofilms like plaque and calculus are sources of bacteria that cause dental caries and periodontitis. So we have three risks of biofilms. The first one is just transfer of infection. The second one is dental caries and periodontal diseases in the mouth cavity. And the third one is the one we're going to discuss today, which is what if those biofilms settle on or are present on or form on medical implants. So why are we discussing this? First, because biofilms are sticky. They are, the bacteria secrete a gluey substance, and therefore they are liable to stick to any material. So medical implants are like tissues or even metallic or plastic or ceramic devices that are implanted inside the human body or implanted on the surface of the human body. And they are used, of course, in medicine. So medical because they serve medical purposes, and implants because they are inserted into the human body or onto the surface of the human body. What are medical implants made of? They are made of different materials, like plastic, like ceramic, like metal, like bone, like even skin. We sometimes do a skin graft, for example, to replace a damaged, burned skin area. So why are we discussing medical implants? Because biofilms can deposit on medical implants. And of course, if biofilms deposit on medical implants, they would be extremely dangerous. For example, if they deposit on a cardiac stent that is put inside the coronary artery that supplies the blood with the heart with blood, that supplies the heart with blood, then the bacteria on the stent might spread to the blood and cause bacteremia. If a biofilm deposits on a skin graft, then the bacteria may cause inflammation of the skin graft, and medical doctors or surgeons would find themselves obliged or forced to remove the graft because it would be no more functioning. Or if, for example, we have a prosthesis, for example, the prosthesis that substitute a missed limb that has been amputated after gangrene, then in such a case, we might be forced to repeat the surgery if infection covers the prosthetic part or reaches the prosthetic part. And now we are going to discuss the different types of medical implants where biofilms can be deposited and result in spread of infection or damage of the medical implant. So if you want to categorize or to classify the risks of biofilms on medical implants, they are two broad categories. The first one is spread of infection through the implant, or the second one is damage of the implant and repetition of the surgery. We have implants, different types of implants, and every one serves a particular function. So prosthetic limbs or prostheses in general help replace a missing body part that has been amputated, or even might be used in total knee replacement or total hip replacement or any total joint replacement where you remove the original natural joint and you put a prosthesis. But the second use is to monitor body functions. So to control body functions, for example, or whatever medical function. So chemotherapy ports are used to deliver chemotherapy medication. Cardiac stents, as you can see here, they are used to support. There are certain prosthetic or certain medical implants that are used to support organs and tissues. And the cardiac stent is one good example because it keeps the coronary artery open, it supports it, and therefore ensures regular blood flow to the heart. Implants, on the other hand, can be classified according to whether they are temporary, put for a short period of time in the human body, or whether they are permanent. For example, if we put a hip implant, if we replace the hip joint by a prosthetic one, or if we use a cardiac stent, then each of these medical implants is designed to be staying there forever. But for example, if you put a screw or screws and a metallic plate, screws and a plate in order to join two fractured ends together of a bone, then once the two fractured ends join together and the bone is healed, then we can remove the plate and the screws. Similarly, chemotherapy ports are considered temporary because you use the chemotherapy ports as long as the patient needs them, but once the protocol of the therapy is finished, then we no more use them. Here you can see the cardiac stent, and we use the cardiac stent together with a catheter and a balloon. The catheter is a cylindrical flexible tube that is designed to carry the balloon at its end, and the catheter is inserted in a big vein in the body, and it will pass through the vein until it reaches the very small coronary artery in the heart. And of course, this is under ultrasonic guidance. You cannot do this blindly. You should be monitoring the passage of the catheter in the blood vessel until it reaches the coronary artery. Once it reaches the coronary artery, you inflate the balloon. So the coronary artery that was previously closed and occluded and obstructed by fatty deposits and cholesterol will be open, or will be opened actually, and you now insert that grid-like substance or material that is the stent, and the stent is kept there. And some recent stents are designed not only to stay there to support the coronary artery and keep it open and ensure adequate blood flow to the myocardium of the heart, but it is also there to release medication that further dilates and widens the coronary artery. Here, of course, you can see a prosthetic limb, and that prosthetic limb has been inserted in order to, or applied in order to support the limb and replace or make up for the part that has been amputated, for example, after gangrene. Here you can see another prosthesis or a prosthetic hip joint. Usually it is a metallic hip joint that's made of non-reactive metal, meaning that this metal is will not be rusted, for example, will not be oxidized and rusted like iron inside the human body. And that's why those metallic things are very expensive, because they are made of non-reactive metals. Here you can see the pacemaker of the heart, the artificial pacemaker. Usually inside the heart, there is a natural pacemaker present in the upper right chamber of the heart, which is the right atrium, and it is a part of the cardiac muscle that can generate electric impulses spontaneously on its own and can spread those impulses to the whole heart to make the whole heart beat at its own rate. And that's why we call it the maker of the heart, meaning that it regulates the heart rate. But if the pacemaker, the natural pacemaker of the heart, is diseased and the heart rate is abnormal and is intractable, meaning that it cannot be treated by regular medication, then we implant this artificial pacemaker that is connected with through a cable to the heart, and it can fire or send electric impulses at a regular rate that mimics the normal heart rate. And it is usually inserted under the clavicle or the neck bone. So it is usually inserted under the clavicle or the neck bone, the collarbone. And usually it is permanent, unless all of a sudden the heart resumes its normal, regular rate. Here we have the chemotherapy port, and as you can see, it is a device that is implanted under the skin and that is connected with a catheter. Again, what is a catheter? It is a flexible tube that is inserted into a vein, and there are points of palpation here that are a bit raised so that you can, if you palpate over that or those palpation ports, you can see or detect where the port is, and therefore you can insert the needle into the space in between the palpation points to deliver chemotherapy medication. I might ask you, why do we use a chemotherapy port? Of course, the first short answer is to deliver chemotherapy medication. But why wouldn't we deliver chemotherapy medication the regular way or the easier way through direct intravenous injection? This is because sometimes the chemotherapy drug itself is irritating to the wall of the vein. So inflammation occurs in the wall of the vein because of the chemotherapy itself. The chemotherapy is good at killing cancer cells, but it has side effects like killing white blood cells and diminishing immunity. And here is another side effect of the chemotherapy medication, which is to plug or to obstruct the vein just because of severe inflammation that occurs. And if the vein is occluded, then the chemotherapy drug cannot reach the body. Another problem of chemotherapy medication is that it happens sometimes when the nurse, for example, is not well trained, or when the veins are not really palpable, that there is leakage or extravasation of the drug outside the vein, meaning that part of the medication leaks outside the vein and causes severe inflammation and severe pain. So if you want to give chemotherapy medication several times for a relatively long period of time, then you would be forced to use chemotherapy ports in order to avoid the side effects of chemotherapy medication. We have other famous daily life examples of biofilms, like the plaque that forms on your, like the plaque that forms on your teeth, like the algal coat, this green scum that forms on stagnant small water canals, or on ships and boats that are not moving and that are stand still in fresh water in particular. And we have rocks that are, we can also have rocks that are covered by that green scum. And by the way, that green algal scum is very slippery. Those are visible. Plaque is almost visible. Calculus is, of course, visible. The algal green scum is visible. But sometimes the biofilm is not visible, and therefore it can cause you infection without you being aware of this. For example, biofilms can form on toilet seats. Biofilms can form inside and around a sink. Biofilms can form on desks and countertops, on doorknobs, and the list is endless. But biofilms can also form on cutting boards. Why? Because not specially, even if you use whether you use a cutting board to cut raw chicken and raw meat, or if you use a cutting board to cut vegetables and fruits. Sometimes people cut vegetables into slices without washing them previously, and then they wash them later on. Of course, this is very, very nauseous, and nauseous here means harmful, Nocious. So this is extremely harmful because the bacteria in the vegetables might stick to the cutting board, and even if you do your best to like clean up this biofilm, you wouldn't be able to remove it completely. Similarly, when you cut it into slices, sorry, nauseous, I was checking the spelling of nauseous. Nauseous is Noxious, to my greatest surprise. Sometimes when you, for example, cut a potato into slices without previously washing the skin, the bacteria are introduced into the substance of the potato itself. Another thing is that raw meat, as you know, and raw chicken can transfer salmonella and can transfer other serious microorganisms that might cause food poisoning. So first of all, you have to separate cutting boards of vegetables and fruits from cutting boards of meat and chicken. And second thing is that you have to wash the vegetables and fruits before cutting them into slices. What kind of organisms are present in the biofilms? We have plenty of organisms. We might have fungal organisms, algal organisms, protozoans, and we might have, of course, food debris if we're talking about biofilms in the mouth cavity, for example. And now we move on to the types of infections. We can classify infections into two types. If you classify them according to the presence or absence of apparent symptoms, then you will divide them into clinical and subclinical. What is subclinical? Subclinical means not yet clinical, meaning that you have an infectious organism that has penetrated your body cells and fluids or fluids, but you don't yet have symptoms and signs. In case of clinical infections, you will have a microbe that has, of course, a pathogenic one that has penetrated your body cells and or body fluids and caused apparent symptoms and signs. But there is another way of classifying infection according to how widespread in the body it is, according to the extent of the infection. If the infection is like here, for example, it is just around the area where the microorganism penetrated. If it is located around the site of penetration of the pathogen, then it is a localized infection. For example, like here, a small infected abscess or an infected wound. An infected wound is a wound, essentially, that got infected. So this is not an infected wound because the abscess is closed. What is an abscess? An abscess is, first of all, a localized infection, meaning that it is around the site of entry of the microbe. It might have started as a very small pinpoint wound in the skin, and then it became an abscess. But an abscess is a closed swelling resulting from accumulation of pus. You can say this, or you can say it is a localized purulent infection. And purulent means full of pus. And pus is nothing but dead white blood cells. What are the signs of local inflammation? They are, or signs of local infection. Signs of local infection are nothing but signs of local inflammation plus or minus the formation of pus. So what are the signs of local inflammation? The signs of local inflammation are redness, as you can see here, swelling, again, as you can see here. But there are two things that we cannot see. they are only felt upon palpation or upon examination. We have heat at the site, not fever, by the way. Heat at the site, I mean local warmth at the site. And in addition to this, we have tenderness, meaning that if you touch this inflamed area, you will feel pain. Isn't localized infection associated with fever? Only when it is a severe localized infection, like, for example, a huge abscess in the breast of or in the mammary glands of a lactating mom. But infection can also be systemic infection, meaning systemic, by the way, not systematic. Systematic means an organized way that follows a certain system. But we are talking about systemic infection. Systemic infection means that you have a microorganism that has penetrated your body, cells and or body fluids, and that resulted in infection. And that resulted in widespread symptoms and signs. It resulted, of course, in infection because it penetrated your body cells, but it resulted in widespread symptoms and signs. Widespread symptoms and signs can be said in another way. It affects multiple systems in the body, and that's why we call it a systemic infection. Like, for example, when you get influenza, you have rhinitis or a runny nose, you might have a sore throat, you might have inflammation of your ears, you might have generalized body aches, you have fever, of course, you might have joint pain, you might have abdominal pain, gastritis, nausea, vomiting. All these are symptoms affecting many areas, and some serious infections like meningitis, for example, that affects the meninges around the brain, the membranes around the brain, or even encephalitis, which affects the brain itself, might be associated with inflammation and infection of the brain and death. Now, what are the signs and symptoms of local infection? We said that fever only occurs when localized infection is severe and when the abscess is huge. And by the way, the pain, let me postpone this to pain. The second symptom and sign is foul odor discharge. Is it a symptom and sign? Yes, it is a symptom because you as a patient complain of it. And it is a sign because it is something that the patient, the doctor, the medical doctor detects upon medical examination. So be cautious because you might be asked about the definition of a symptom and a sign. Third, and the foul odor discharge, by the way, results from pus, because pus is dead white blood cells plus dead bacteria. And of course, this is associated with chemicals that have a foul odor. And by the way, the abscess does not release a foul odor unless or until it is opened or ruptured. Heat at the site, pain, redness and swelling, all these are signs and or symptoms due to histamine release. I might ask you about the cause or the underlying cause, the pathogenesis, how all these symptoms develop. Of course, what I've just said are different forms of the question. I might give you the signs of inflammation and say, what is the pathogenesis of inflammation? Meaning how inflammation develops. Or I might ask you about the underlying mechanism or cause of these signs. So whether we are talking about heat or swelling or redness or warmth, the four signs are due to tissue injury, release of histamine from injured cells, vasodilatation or widening of the blood vessels, increased blood flow. Now, the symptoms and signs of systemic infection include primarily fever, and the fever, as we should have said here in systemic infection, the fever is due to pyrogens. It's not written here. We have mentioned it before. So I'll start by fever. Fever is one of the symptoms that are consistent and almost always present in systemic infections. Only few diseases are not associated with fever, systemic diseases. And what is fever, first of all? Fever is the elevation of body temperature above normal. What is the normal? The normal is 36.8 degrees Celsius to 37.2. What's the underlying mechanism of fever? There are chemical substances secreted by bacteria and pathogens that reset the heat regulating center in the brain to a new higher temperature or to a new higher level. But we also have body aches that are still caused by toxins and pyrogens. We have chills, we have nausea, vomiting, especially if the systemic disease affects the stomach and the gut. And of course, we have overall weakness. And the weakness results from fever, because when you're feverish, there is an increased rate of metabolism. There is an increased rate of all the biochemical reactions in your body, plus that fever causes anorexia or loss of appetite. So you are burning fuel, you're burning glucose at a higher rate, you don't have good appetite, and that's why you feel weak and you lose weight. Now, infection transmission, we have, of course, the person-to-person transmission, and the person-to-person transmission can be through touch or direct contact, as we said before. But we are not going to repeat this. If your hand is contaminated with dried out droplets of saliva or mucus, or through contaminated blood and body fluids. Through contaminated blood, like hepatitis B, hepatitis C, AIDS, which is caused by HIV virus or human immunodeficiency virus. HIV is the name of the virus. AIDS is the name of the disease. AIDS stands for acquired immunodeficiency syndrome. But hepatitis A is food-borne and water-borne. Saliva or droplet infection. Again, we define droplet infection as small droplets of saliva or sputum or nasal discharge that are released upon coughing or upon sneezing. Of course, all respiratory tract diseases are, because I might ask you to give examples of diseases that are transmitted this way or the other. So droplet infection is a famous method of transmission of infection in case of upper and lower respiratory tract diseases, diseases of the nose, of the throat, of the trachea, of the lungs. You also have an airborne infection. As I said before in the previous classes, that there is great ambiguity in this classification because there is great overlap. So if I say, for example, contaminated blood or body fluids, they will include droplet infection, but droplet infection is airborne infection and is dust-borne infection. So airborne infection is when droplets are transmitted via air, and dust-borne infection is when droplets of saliva, sputum, and nasal discharge fall onto dust, dry out, and then are carried again by air. Foodborne infection, this is mainly through food handlers or those people who handle food. It might be a mom or a dad if they don't have a proper hygiene, or it might be a worker in a restaurant, for example. Foodborne infection microbes, of course, like the food we like, so they might contaminate our food. And one of the famous examples of foodborne infections are gastroenteritis and food poisoning. Gastroenteritis, itis means inflammation. This means inflammation of the mucosa of the stomach and inflammation of the mucosa of the small intestine. When they are inflamed, they are not carrying out their functions properly. They are irritated. There is nausea, vomiting, loss of appetite, diarrhea, loss of weight. Food poisoning is the same as gastroenteritis, but food poisoning is a more severe form of gastroenteritis that might require hospitalization and might require rehydration of the patient via the intravenous route. what organisms cause this? We're going to see this later on, but of course, you all know that salmonella, for example, that's present in raw chicken and sometimes raw meat and sometimes eggs, is a famous source of food poisoning, sometimes in dairy products. We also have E. coli that is transmitted via flies, house flies. All these are organisms that can cause gastroenteritis or food poisoning. Foodborne infections usually transmit via unclean hands. So unclean hands will spoil or will contaminate the food or your utensils, and therefore when you eat the food or drink the water or use those utensils, you're gonna catch the infection. Or it might be a droplet infection. A food handler might contaminate food not through his hands, but through coughing or sneezing onto food or onto the water they serve you, and they do not take the necessary precautions to protect the food or the water, and as we have just said, from unclean kitchen utensils. We also have waterborne infection, and by waterborne infection, we essentially mean when you drink contaminated water rather than the cercaria and the fresh water of bilharziasis. Waterborne infection, by definition, is infection transmitted through unclean water, and it can again cause, although it's not written here, it can again cause gastroenteritis, food poisoning, typhoid fever, and cholera. Typhoid fever is caused by Salmonella typhi. Cholera is caused by Vibrio cholerae. Cholera is almost similar to food poisoning, but it is even more severe than food poisoning. So if I arrange those three diseases in an ascending way concerning their seriousness or how fatal they are, we would start by gastroenteritis, ascending order. Gastroenteritis followed by food poisoning, followed by cholera. So cholera is the most serious one because in cholera, it's intractable. And in the past, there wasn't, before the discovery of tetracyclines and the specific antibiotics of cholera, it was really fatal. And it was an epidemic disease, meaning that it is a disease that spreads at a very rapid rate in a certain area and the neighboring areas. Cholera is characterized by watery diarrhea, watery, colorless diarrhea. In typhoid fever, why did I put typhoid fever apart? Why didn't I include it in the series of diseases like gastroenteritis, food poisoning, and cholera? Because typhoid fever is different in the fact that it does not cause diarrhea, but on the contrary, it causes constipation. So the patient comes to the clinic with severe fever, high fever, very high fever that reaches 40 or 41, severe headache, partly from the fever and partly from the toxin, severe abdominal pain. But despite this abdominal pain, he does not have diarrhea. On the contrary, he suffers from constipation. Insect-borne infection is infection that is transmitted via insects. And here, insects are not pathogenic. They are not themselves pathogenic, but we call them insect vectors, meaning that they are transmitters of infection. And that's through their carrying of pathogens either inside their abdominal cavities or the salivary glands or onto the hairs of their legs, like in houseflies. So a housefly per se is not pathogenic, but a housefly can transfer salmonella or E. coli via the fine hairs on its body. Furthermore, if it sucks a contaminated food, then it would vomit that contaminated food onto the food that it stops on or stands on. So there are famous insects like female Anopheles mosquito, Anopheles with a PH, and like the rodent fleas or rat fleas. The female Anopheles mosquito transmits malaria from one person to another. So if a certain diseased person has malaria, it has the protozoan Plasmodium malaria in the blood. So Plasmodium malaria is the causative organism, and it is a unicellular eukaryotic sporozoan. Sporozoan means unicellular eukaryote because eukaryotes are not usually unicellular. And the mosquito does one thing. It sucks blood from the case, from the diseased person, and goes to another person that is originally healthy and pierces its skin with the piercing mouth parts and vomits the blood with the Plasmodium malaria into the wound and therefore into the blood of the second person that was previously healthy. So the causative organism is Plasmodium malaria, whereas the insect vector is the female Anopheles mosquito. On the other hand, we have gangrene. Gangrene is also called bubonic plague, plague with a G, not plaque. Bubonic because it is associated with swollen lymph nodes or buboes, and plague or Black Death because the toxins and the severe tissue destruction and inflammation of the toes and the extremities of the body caused by the bacterium result in black discoloration of the dead tissues. Of course, you have to amputate the foot on the spot. Otherwise, there is the risk of transfer of toxins to the rest of the body. And this is a question. Why is amputation mandatory in bubonic plague? So the causative organism in bubonic plague is the bacterium Yersinia pestis. It's not a protozoan, it's a prokaryote. It is a bacterium. But the vector is the rodent flea. So the bacterium Yersinia pestis, which is the causative organism, is essentially in the body of the mouse, in the body of the mouse, the rodent, or the rat, usually in big rats on ships, and it is transmitted via the rat flea to a human being. It is associated with gangrene. What is gangrene? Gangrene is death of the tissues caused by the bacterium and its toxin. And this gangrene or death of the tissues results from two things: severe inflammation from one part and the toxins that cause occlusion of the blood vessels. So if the blood flow does not reach the periphery or the toes, then this part of the foot will die. As we've said, food poisoning results from Salmonella mainly and E. coli, and they come from fecal waste. Those fecal waste can come from the hands of food handlers or from house flies. Fomite-borne infection is infection transmitted via fomites. What are fomites? Fomites are non-living objects that can transfer infection, that might carry disease-causing organisms. In such a case, we cannot say that those pathogens form a biofilm because fomites are usually dry. So, but the organisms still succeed in attaching themselves to the fomites because of the gluey substance they secrete. So beddings, for example, towels, toys, barbed wires, countertops, countertops, doorknobs, all these are fomites that can transfer infection. One of the major and most famous organisms that are transferred via fomites is trichophyton with a PH and a Y. Trichophyton is a fungus, multicellular fungus, and trichophyton loves, just like any other fungi, loves living in damp, warm, moist areas, dark, damp, warm, moist areas. And because the area between the toes is usually moist in summer, especially in athletes who wear their socks for long and do not have time to change them, so they always perspire or sweat. Perspiration is insensible sweating that occurs even in winter. Then, especially between the fifth and sixth toe, the fourth and the fifth toes, we will find trichophyton. And trichophyton causes a famous fungal infection called Taenia pedis. Pedis means foot, and Taenia without an A, T-E, is the name given to that fungal disease. And of course, it is highly contagious. So we shouldn't exchange our socks. We shouldn't exchange our towels, even after having washed them. Now, you might be asked on the test to, for example, give examples, 4 examples, 5 examples of control of spread of infection. So you might talk about the use of vaccines, and vaccines are substances that are injected into your skin or into or under your skin. There are several ways of applying the vaccine to stimulate the immune system. And there are 2 types of vaccines, as we said before. The live vaccines, in which you use a living organism, but that has been weakened or attenuated with a double T. But you can also use a dead organism. Of course, live attenuated vaccines are the live ones, or the ones that are alive, are more effective in stimulating the immune system, but they are more risky because they might, in certain conditions, if your immune system is compromised, they might cause the infection. The rest is easy, and therefore it's easy for you to understand it, so I wouldn't waste time going over it. But this one, number 8 and number 9, are very important. You shouldn't touch your eyes, your nose, or your any mucous membrane, especially if you are outdoors and if your hands are not clean. You shouldn't share cups. You shouldn't share utensils in general. And you shouldn't share food. You shouldn't bite an apple, for example, and then give it to a classmate. We should ensure good aeration of the place. There should be a slight air current to wash away the microbes. Of course, you should use single tissues, disposable tissues, and you should wash your hands frequently and stay home whenever you're sick. But coming to washing hands frequently and using disinfectants, the irrational use of disinfectants is sometimes harmful, because you're not only removing the pathogen, but you are also removing the friendly flora that fight pathogens. Now, as you know, viruses are not considered living organisms. Why? Because when viruses are present outside a living cell, outside the human body, for example, like when they are present on your desk or on a countertop or on a doorknob, they are not alive. They reproduce only in the body of a living organism, and they are capable of staying there and be infectious or infective first for only for a few hours, that vary from one virus to another. So the normal viruses, or most of the viruses, stay capable of infectivity for a maximum 8 hours. But some viruses, like COVID, for example, can stay infectious for 24 to 48 hours. Of course, we shouldn't share or repeat the use of syringes, because they might transfer blood-borne infections. We should avoid pin pricking, because, as we know, if your skin is pricked, this makes a wound and tissue injury and inflammation, and this encourages some organisms that were previously friendly to penetrate your skin. And we should sterilize the surgical instruments. And sterilization is different from disinfection. Disinfection is the diminution of the number of microorganisms using the regular methods of removal of organisms, like using, for example, Dettol, like using alcohol, and so on. But sterilization is something more elaborated. So it is the absolute removal of organisms, zero microorganisms, and it requires more sophisticated tools and instruments like an autoclave, for example. And this is what happens in surgical wards, in dentist clinics, in gynecology clinics. You should also avoid as much as you can invasive medical procedures. I might ask you, why should or justify we should avoid invasive medical procedures? Because invasive medical procedures like a cardiac stent, for example, you might end up by getting a biofilm on it. Invasive dental procedure, you might end up by getting a disease called subacute bacterial endocarditis. You also should use masks because masks will diminish droplet infection, and that's why dentists might use masks, because even while talking, we always describe droplet infection as being the result of coughing or sneezing, but sometimes when we talk loudly or rapidly, there are invisible droplets of saliva that are released from our mouth cavity. And now we come to the most important way of controlling infection, or the most important part of controlling infection, which is the use of antibiotics. Of course, before the era of antibiotics, people used to die from severe infections, but now an antibiotic is a substance that is capable of killing the microbes or the pathogenic organisms. As we said before, there are two types of antibiotics. There are narrow spectrum antibiotics that affect only a narrow number of species, and there are broad spectrum antibiotics that can affect a wide array of pathogens. We use, of course, broad spectrum antibiotics when the diagnosis is not accurate, when you don't exactly know what pathogen is the cause of the infection. You will be using a broad spectrum antibiotic that is usually having more side effects. But there is a major risk of using antibiotics in addition to the normal side effects of antibiotics, because when you give an antibiotics, how does the antibiotic work? It usually works by preventing reproduction of bacteria. And how does it prevent reproduction of bacteria? By preventing the replication of the molecule of heredity, which is DNA. But if it does this for the bacteria, it will also do this for your body cells. And that's why you, for example, white blood cells. That's why if you use antibiotics for a long period of time, you might have lowered general immunity in your body. But there is another risk of antibiotic that does not occur normally, but it occurs because of misuse of the misuse of antibiotics, like for example, if you take an antibiotic and it has been prescribed for a week, which is the classical way we used to describe the previous generation antibiotics, for a week, every 8 hours or every 6 hours. But nowadays, of course, there are antibiotics that are taken as one dose. For example, you take 4 pills once a time or for 3 days only. But I'm talking about a certain dose that has been prescribed by the medical doctor. Once you take the first or second, the first dose or the first 2 or 3 doses, you start improving. And when you start improving, then you feel like, why would I take the antibiotic and expose myself to all these side effects? So you stop the antibiotic. So what happens exactly? That you will, after a day or a couple of days, you will feel a relapse, meaning that there will be exacerbation or increase of the symptoms and signs again. Why? Because when you take an inadequate dose, whether because you took a lower dose than required or you took the dose for a shorter period of time, then in such a case, you're killing only sensitive bacteria, the ones that are affected by the antibiotic. And these are the majority, by the way. But in every community of bacteria, there is also a minority of bacteria that are resistant, that are not responsive to the antibiotic. And when you kill the sensitive bacteria by having taken an inadequate dose, then you're freeing the space for the mutant resistant bacteria that were already there to flourish, because they would reproduce uncompeted. And I repeat and emphasize that resistant bacteria did not develop because of the misuse of the antibiotic. They were already there, but they increased in number because of the misuse of antibiotic. And that's the cause of the relapse. And this results in other bad consequences, like, for example, that the next time you would be infected with the same microbe, you wouldn't be cured by the same antibiotic. And other people in the community around you that were infected by the microbe that you transmitted to them will not be cured by that antibiotic. So scientists and pharmacists in particular would be forced to synthesize new antibiotics in the labs, new generations of antibiotics. And so what? These new generations of antibiotics would be more expensive and would have more side effects. And now we come to the prokaryotes and the eukaryotes, and I remind you that you will have to draw the prokaryotes, and you have to have your pencil colors with you. So all bacteria are prokaryotes. What are prokaryotes? So if I ever ask you to give an example of prokaryotes, you would say bacteria. Prokaryotes are unicellular organisms. Not only are they unicellular organisms, but just like any other organism, just like any other cell, they have a cell membrane. All living cells have cell membranes. So this is not a characteristic of prokaryotes. But one of the characteristics of prokaryotes is that they are unicellular. Another characteristic of prokaryotes is that they have a cell wall. You might be asking yourself, but plant cells have a cell wall. Yes, but prokaryotes have a cell wall that's made of peptidoglycan, peptides and carbohydrates. Furthermore, they have a cytosol, the jelly-like substance around the organelles, but all cells have cytosol. So again, just like the cell membrane, this is not a characteristic of prokaryotes. They have DNA, and so what? All living cells have DNA, but their DNA is characteristic. Why? Because it is a single circular folded DNA molecule, single circular folded DNA molecule that is not surrounded by a nuclear membrane, and that's why it is not a true nucleus. Coming to the organelles, they have ribosomes, and so what? All living cells should have ribosomes because the ribosomes are small organelles. An organelle is a small specialized structure, usually surrounded by a membrane, but here the ribosomes are the only organelles that are not surrounded by a membrane, and that's why they're present in bacteria and they are the sites of protein synthesis. Because ribosomes are the sites of protein synthesis, they are present in all living cells, but they do not have any other organelles. On the other hand, eukaryotic cells present in higher organisms have different characteristics. Whether they are animal cells or they are plant cells, they have a true nucleus that is surrounded by a nuclear membrane. And they have multiple DNA molecules that we call the chromosomes. And they have more or less all types of organelles. So they do not only have ribosomes, but they also have membrane-bound organelles, just like Golgi apparatus, mitochondria, endoplasmic reticulum, vacuoles, and lysosomes, and so on. But there are by the way, there is a difference between a eukaryotic cell and a eukaryotic organism. A eukaryotic cell is a eukaryotic cell, but a eukaryotic organism is an organism made up of eukaryotic cells. It might be unicellular or multicellular, but prokaryotic organisms are always unicellular. Now, what are the differences between an animal cell and a plant cell? We have three major differences. The first one is the cell wall, the cellulose cell wall. And cellulose is a complex polysaccharide, a complex carbohydrate. There is no cell wall in animal cells. The second thing is the vacuole, where they store the surplus fluid and salts. In the plant cells, there is only one large central sap vacuole, whereas in animal cells, we have multiple small vacuoles. And the third important difference are the green organelles that are called the chloroplasts, where photosynthesis occurs. And photosynthesis means that plant cells can make complex organic food like glucose from simple inorganic substances like carbon dioxide and water in the presence of sun rays and because of the presence of this green pigment called chlorophyll. That's why, because plant cells do or carry out photosynthesis, they can make their own organic complex food, and they are considered autotrophic organisms. Auto means cells. Trophic with a PH means food, so or nutrition, so they can form their own food. This is in contrast to what? This is in contrast to fungi, because we have said before that fungi are heterotrophic, meaning that they cannot make complex organic food from simple inorganic material, and they have root-like substances that fix them to the soil, and they absorb ready-made organic substance from or through those roots, like bread mold, for example. Viruses, as we have said before, are not considered living organisms because they cannot reproduce outside a living cell. What is the major structure of a virus? It consists of an essential core, central core of nucleic acid, and that nucleic acid can be a DNA, like in the bacteriophage, or it might be an RNA, like in influenza viruses, COVID-19, and hepatitis virus. Around this central core of DNA or RNA, we have a protein coat, a coat that surrounds the nucleic acid. This is common to all viruses, but in addition to this, you can here see the central nucleic acid part, and it is attached to proteins. That's why we call it a nucleoprotein. And you can also see the green capsid or coat that is made of a protein. This is the influenza virus anatomy, but as you can see, in addition to the central nucleoprotein core that's made of RNA and the protein coat or capsid, we have a lipid envelope. And the lipid envelope is usually derived from the cell membrane of the host, because you know that after viruses reproduce inside a cell through the lytic cycle, the host cell would rupture and the virus will leave the cell. So when the virus is leaving the cell, it takes a part of the cell membrane of the host with it, and that's why not all viruses do this. Some other viruses, like the bacteriophage, have additional structures. But first of all, what is the bacteriophage? The bacteriophage is a virus that can infect bacteria and cause their destruction. The bacteriophage has a central core made of nucleic acid, DNA, and a protein capsid or coat around it, and we call this the core plus the capsid, we call it the head. Why haven't we called it a head here? Because there wasn't a neck or a tail, but here we have a neck and we have a tail, and we have tail appendages, like extensions of the tail or protein filaments. Now, how does the bacteriophage replicate? There are two methods of replication. The most famous one that occurs most of the time is the lytic cycle. We call it cycle because it is a series of events that repeat themselves. And we call it lytic because it ends up by lysis of the host cell. I'll explain it on the slide because maybe the diagram is too complex for some of you. First of all, it will attach or adhere to the bacterial cell wall, and then it will inject through its tail, which looks like a syringe and acts like a syringe and is elastic and compressible. It will inject the DNA into the bacterial cell, and it will leave the empty coat outside, and this empty coat will be lost afterward. We will not be using it another time. And then once the viral DNA is inside the host cell, it will take over, it will dominate, it will force the bacterial metabolism to replicate its own viral DNA. What is replicate? It's to make copies of its own viral DNA. And meanwhile, it destroys the bacterial DNA. It keeps the biochemical reactions that help replication of the viral DNA and destroys the rest of the bacterial DNA. And then those copies of viral DNA that have been formed will be used to form a protein coat. We will use the code on these viral DNAs to make protein coats. And then the final stage is assembly of the DNA of the virus with the corresponding protein coat to make thousands of copies. Is this replication and reproduction? Yes, because it's only one viral particle that entered the bacterium. And at the end of the day, at the end of the cycle, we ended up by having thousands of viruses. But now the bacterium can no more afford the presence of this huge amount of viruses inside. So it ruptures. And of course, the cell membrane and the cell wall got weaker. So it ruptures and the viral particles will be released to infect other persons. So we ended up by having lysis or rupture of the host cell. But in the lysogenic cycle, sometimes some viruses like the bacteriophage do both, meaning that in some hosts, like in liver cells, for example, in human beings, the hepatitis virus, not the bacteriophage. The bacteriophage can do the lysogenic cycle in bacteria, but the hepatitis virus can do the lysogenic cycle in human beings, in liver cells. During an attack of hepatitis, it attaches itself to, or it attaches its DNA to the DNA of the host. It causes mutation. This is what we call the prophage. The prophage causes mutation, and it might result in cancer later. So what is the lysogenic cycle? In the lysogenic cycle, the first steps are common, meaning that is there attachment of the phage to the bacterial cell wall? Yes. Will it inject its DNA inside the bacterium? Yes. But will this viral DNA take over? No. This is the difference. The viral DNA will attach itself to the bacterium DNA, forming a prophage. What is a prophage? A prophage is a dormant stage of the cycle that results from attachment of the viral DNA to the host cell or the bacterial cell DNA. This results in a mutation, but it does not result in lysis. When the bacterium reproduces by binary fission, which is an asexual type of reproduction, and divides into two, it duplicates its DNA, and meanwhile it duplicates the DNA of the virus. It duplicates the DNA of the virus. The virus stays there for years and years until after several cycles or several years in case of hepatitis, it changes to the lytic cycle. If it stays like this without changing into a lytic cycle, it would cause cancer. Fungi, as we said before, are heterotrophic organisms, and we said the definition of heterotrophic. They might be unicellular, like yeast or candida. We have seen candida albicans in the vagina, and yeast is the fungus that we use to raise dough, all types of dough and in bakery, and they reproduce asexually. But candida, the unicellular one, reproduces asexually by budding, whereas and yeast also. But the multicellular ones, like bread mold, for example, or mushroom or penicillium, will reproduce by spores, by spreading spores or sporogony. These spores will be shed away from bread mold or from mushroom, and they will fall onto the soil or onto the medium here. They will absorb water and they will germinate into a new one. So it is asexual by sporogony. Of course, penicillium is a fungus. It is used, we extract the penicillin antibiotic from it. Bread mold here is bread mold, and it is also a fungus, and mushroom is a fungus. Now, the Bilharzia worm, of course, is a multicellular organism. It reproduces sexually by gamete formation or gametogamy. There is a male and a female adult worm. But how does infection occur? Infection occurs by cercaria. So the cercaria is the infective stage. It results from hatching of Bilharzia eggs that have been shed in water. It contaminates water. It gets into contact with the skin, penetrates the skin, reaches the blood. So what is the infective stage? Cercaria living in fresh contaminated water. After having reached the blood, it changes into a larva. The larva goes to the lung and causes coughing. So the cause of coughing is the larval stage reaching the lung. And this occurs similarly in Ascariasis. Another question that you might be asked about is the presence of hematuria in urinary bilharziasis. This is because the eggs are spiny. They are deposited by the adult female worm in the mucosa of the urinary bladder. They injure the mucosa of the urinary bladder and cause bleeding. So it is associated with hematuria or bloody urine and dysuria or pain during urination. In intestinal bilharziasis, there is no hematuria or dysuria, but there is rectal bleeding or bloody diarrhea. Why? Because the spiny eggs again are deposited in the inner mucosa of the rectum, and they cause injury of the blood capillaries of the inner wall of the inner mucosa of the rectum, resulting in bloody diarrhea. But on the long run, there are complications of intestinal bilharziasis that do not occur in urinary bilharziasis. What are they? They are hepatomegaly or enlargement of the liver. They are splenomegaly or enlargement of the spleen. They are hematemesis or vomiting of blood from the blood vessels around the esophagus. And finally, the inflammation of the liver might result in fibrosis or cirrhosis of the liver and hepatic failure at the end of the day. The Ascaris worm is the roundworm. It again reproduces sexually by gametogamy or gamete formation. But here, the transmission of infection is a bit different. There are similarities with bilharziasis, which is sexual reproduction by gametogamy and laying eggs by the female and coughing due to the larval stage passing into the lung. But there are differences in symptoms and there are differences in the way of acquiring the infection. How do we acquire the infection? By drinking water contaminated with fecal matter that contains the eggs of Ascaris, or eating food contaminated with fecal matter that is contaminated with the eggs of Ascaris. Here, there is no cercaria, there is no penetration. Now, where are the eggs laid? They are laid in the cavity of the small intestine. Some of them hatch in the small intestine, become larvae, reach the blood and then the lungs, and then cause coughing and become adult worms. And some of them are shed with the feces into water and therefore can reach food. So the eggs are laid into the cavity of the small intestine. Not all of them hatch into the cavity of the small intestine. The ones that hatch give larvae. The larvae reach the blood and then the lungs and then develop into adult worms and return again to the small intestines, whereas the eggs that do not hatch are shed into the fecal matter, into water, and then into food. Now, the main symptoms, of course, will be gastrointestinal. So you will have nausea, vomiting, loose stools or diarrhea, loss of appetite because of the inflammation in the stomach, It can also be associated with abdominal pain and weight loss. What is the cause of weight loss? The cause of weight loss is that the worm absorbs your nutrients, so you do not benefit from them. And the other cause is that you have vomiting and diarrhea. I might ask you about difficult breathing. It's not only cough that results from passage of the larvae into the lungs, but dyspnea or difficult breathing. We do not pronounce the P. Finally, we have the tapeworms or Taeniases with an A, by the way. Taenia is the name of the worm, and Taeniases is the name of the disease. Taeniases, therefore, can be caused by Taenia saginata or Taenia solium. How are they transmitted? Taenia saginata is transmitted via the ingestion of raw meat or not well done meat that's not well done, because it would contain the larval stage of Taenia in those short segments of Taenia that are called the proglottids. So what are the proglottids? They are the tapeworm segments. Similarly, Taenia solium can be transmitted via raw pork that contains proglottids or the tapeworm segments that contain the larval stage. Tapeworms can cause digestive problems because they similarly cause abdominal pain, loss of appetite, weight loss, and upset stomach, just like in the case of Ascariasis. Thank you, guys. That was the last item in our revision. I wish you all good luck, inshallah. You all worked very hard this year, and I'm very optimistic that, inshallah, you would all get excellent marks on the test. I'll be at school, inshallah, on Sunday during the test, and if you have any questions, you will be asking me over the phone, or they will be sending me WhatsApp messages, and I'll be answering via audios or voice notes. Thank you, guys, and see you on Sunday, inshallah, and wishing you an amazing summer vacation, inshallah. Thank you.